Everybody ready? Good. Okay. Well, first of all, thanks everybody for being here. And I want to begin by saying that it's so very important in this moment that each of us gets vaccinated. It's so important that everybody go out and get your vaccination. Georgia is behind on this score, and we need to play catch up. And so please, for your own health and for the health of your loved ones and your friends, go and get vaccinated. It's safe, it's free. And in fact, you can go right here to Grady. They are vaccinating folks right here Monday through Friday, 11 a.m. to 2:30 p.m. And so I just want to underscore that because our vaccination levels are still too low in this state, and that has real healthcare implications. Let me say that I'm glad to be here once again at the Grady Memorial Hospital. I've been to this hospital many times as a pastor. I've stood at many bedsides. I know firsthand the importance of health care and how vital that is for all of our communities. And Grady is at the front line of that work. And so I want to say thanks to Grady for all that you do day in and day out to keep our families and our communities healthy. Grady's been doing this work before the pandemic, through the devastation of the pandemic, and on the other side of the pandemic. And part of what the pandemic disclosed was the ongoing inequities in our healthcare system. And that's something that I am very, very focused on. And what is clear to me, after speaking to the healthcare officials in this hospital, is that the single most effective solution to closing our state's coverage gap is to expand Medicaid. Georgia is one of only 12 states that's still a holdout. We're one of only 12 states still refusing to expand Medicaid. We need to expand Medicaid, and we need to expand Medicaid now. This will be a significant investment, certainly in the health care of our communities, but it's also an investment in the economy. And so I'm committed to closing the coverage gap here in Georgia and at the federal level. I've been working hard on several fronts to strengthen access to affordable health care in our state. I worked successfully to get money in the American Rescue Plan for Georgia to expand Medicaid to cover the nearly 500,000 Georgians who are eligible and are in the Medicaid gap. I pushed the Biden administration to reject the work requirements that the state is trying to place right now on the citizens of Georgia in order to access the health care that they're already providing through their tax-paying dollars. I think that approach is wrong-headed, and what we ought to be doing is expanding Medicaid rather than playing games with the health care of Georgia citizens. And so I've urged the White House to do something about this legislatively in the coming days. So let me be clear. We put a provision in the American Rescue Plan which gave Georgia more than what it needs to expand Medicaid. And our state officials so far have decided to leave millions of dollars on the table, to leave hundreds of thousands of Georgians in the Medicaid gap. We can cover everybody right now, and we'd have money left over for Georgia schools, Georgia roads, Georgia hospitals. But instead, the politicians are playing games with the people's tax-paying money. And so what I have urged the White House to do it at this juncture is to provide a federal fix in the next jobs package that will allow low-income individuals in non-expansion states like Georgia to get covered. And so I'm glad to be fighting alongside Senator Ossoff, and I'm hoping to introduce legislation soon that will allow Georgians in the coverage gap and those who are low income to get coverage through the federal government, while continuing to incentivize the state to finally expand its Medicaid program. The COVID-19 pandemic both illuminated and exacerbated these long-standing inequities in care and what it costs in the lives of ordinary people. People who have diabetes and don't know it, or who can't get care, people who have hypertension. These issues then cascade into more serious health issues, which are also more expensive to treat. So we need to turn the corner on that. We need to do it right now. And there's no better example of how important and how urgent this issue is than the hospital that's right behind me. Grady sees Georgians, people in this region every single day. 28% of the people that they see are uninsured. If we expand Medicaid, we can make those people paying customers and support this hospital and the work that it does. Grady is the #2 provider of behavioral health in our state, behind the penal system, which is its own travesty, that statement alone, that we're seeing more people for behavioral health in our correctional system than in hospitals. Expanding Medicaid will go a long way to help a number of these issues. I'm going to do everything I can to make sure that we do that. With that, I'm happy to respond to a few questions.
Thank you, Senator.
Sir, do I know you? Yes, Dave. Good to see you, Dave.
Sir, the governor of Georgia said the Department of Justice lawsuit against the state of Georgia regarding the voting law is just a far-left plan to expand their agenda. Your thoughts on those comments and your thoughts on the actual lawsuit itself, sir?
The governor's playing games, and he knows it. We are a democracy, and we have to do everything we can to make sure that people have access to the constitutional right to vote. His own Secretary of State certified the last election. There's no fraud in the election. And all of these onerous provisions that they have put in this unjust law represent a solution in search of a problem. They're creating a problem. And so I will let the Justice Department do its work. In the meantime, I'm going to do everything I can in the Senate to provide a baseline of protection for Georgia voters so that they can access their right to vote.
Thanks a little bit of Riley Bush.
Can you tell us anything about what this federal workaround for Medicaid expansion might look like?
Well, you will see more in the days ahead. It won't be long, but we are working on a legislative fix. Look, this is something I've been working on for years. Before I came to the Senate, I stood up in the Georgia Capitol back in 2014, saying to another governor, expand Medicaid. And instead of expanding Medicaid, they moved the ability to do that from the governor to the state legislature. Politicians are playing games. Meanwhile, people who have diabetes, who have hypertension, HIV/AIDS, behavioral health issues are being denied access to care. And while they're busy imposing these work requirements, I need to see the state legislature go to work and give people the care that they need. Basic health care actually enables people to work. Once you have basic health care, you can pursue employment and with a kind of freedom, and you can work knowing that you're covered. And so it boggles the mind to think that right now we're leaving millions of dollars on the table. We're leaving uncovered care in this hospital that could be covered. We're leaving hundreds of thousands of Georgians in the Medicaid gap. And then the money that's left over that could be going to Georgia roads and bridges and schools, we're not accessing that money. It doesn't make any sense in the world. And we're subsidizing health care in other states while rural hospitals in Georgia are closing. And so I'm going to stay very focused on this issue until we find a way to address the coverage gap in our state. And following a once-in-a-century global pandemic, nothing could be more important and more urgent. Thanks, everybody. All right, I'll take it.
Yeah, so you said you talked to the Biden administration about blocking Georgia's work requirement Medicaid. Can you talk a bit more about that? And could you also talk to them about Georgia's other waiver plan to potentially cut ties with healthcare.gov?
Let me be very clear. The state is the one doing the blocking. I'm trying to provide access to Medicaid, and which is why I put money through a provision in the American Rescue Plan to give Georgia all of the incentives that it needs and then some to expand Medicaid. And it's costing Georgia money not to expand Medicaid. And so the folks who are standing in the way ought to be asked why they're doing this. And the answer is petty politics. But healthcare is a matter of life and death. Dr. King said that of all the injustices, inequality in healthcare is the most shocking and the most inhumane. And the last thing we ought to be doing, as we're still wrestling with this pandemic, is playing with people's healthcare. Yes.
What is the next to the Senate on voting rights? Can you talk a little bit specifically about what you've done to talk to some individual members that aren't maybe not the rest of the caucus, particularly some of the Senate?
Sure. Well, at the end of the day, all of the members of the Democratic caucus were on the bill. So Manchin and Sinema and the rest of the caucus, we're all on the same page. And what the Republicans did last week was they decided that they didn't want to have a conversation about voting rights out in the open so that all of the American public could hear our views on this and what we think is at stake. And I really think that's important because it's easy to miss that because people are busy working. They're not inside the Beltway. They're doing their jobs. But I really think it's important for Georgia voters to understand that it wasn't even the bill last week that got blocked. What got blocked was our ability to have a debate on the bill about voting rights at a time when they passed nearly 400 voter suppression bills. And so all of the members of our caucus are on the same page because we've been having a lot of conversations. I talked to Senator Manchin, I talked to Senator Sinema, and I've been talking to members on the other side of the aisle because the last time the voting rights bill was reauthorized, George W. Bush, a Republican, was president, and it passed the Senate 96-0. So I don't know why they all of a sudden think that voting rights is a partisan issue. I don't think so. I think it's an American issue. And I think all of these voter suppression bills, especially the one here in Georgia, are undemocratic and un-American. And I'm going to do everything I can to make sure that we can have arguments in the public square in America as we do. That's what makes us a great country, about health care, about immigration, about taxes, about whatever. But that at the end of the day, the people have their voice in their democracy. And so when you cut early voting, when you have drop boxes access during hours that are regular hours, which undermines the whole reason for having a drop box. And most importantly, when you create a provision that allows partisan actors at the state level to usurp the power of local election officials, you're creating a dangerous mix, I think, for creating mayhem inside of all of our elections. And I don't want to see that. This is the state of Martin Luther King Jr. And we ought to be doing everything we can to model access to voting rights. And so that's what I intend to do. I do think that there is still a path forward, and I have not given up on passing some form of voting rights legislation that will give us the access that we need and the protections we need. What was that?
What are some of the baselines?
Well, I think we'll see. I mean, I'm talking to folks on the other side, and in the meantime, we're in the majority, and so I do think that as we're witnessing this, you know, and when the voting rights law was reauthorized, as I said, George W. Bush was president and passed the Senate 98-0. Now the minority leader is saying he's against John Lewis also. So we've got to pass voting rights no matter what. And if that means changing the Senate rules in order to do that, that's what we need to do.